So we work with 70% of general practice around the country. We have enabled over 800,000 children access their immunizations. In the past 2 years, we've helped over 3,500 smokers to accept help to quit smoking. And our online booking service has been growing at a rate of 12.5% weekly in the past 18 months. Our key brand promises as an organization is to make primary care more accessible, more affordable, and more convenient. When people can't access a primary care physician, they're going to hospitals. It costs the health system $1,500 just for somebody to say hello in ED department. So our vision is to disrupt hospitals by keeping people in the community and keeping the community highly engaged where they're offering their services on a more timely basis. And the way we do that is through our Vensa.com platform that enables patients to book their appointments online in under 30 seconds, access and pay for their repeat scripts for people with long-term medications. And the real kind of disruptor is the ability for clinicians to practice virtual care, where the clinician gets to enable their services to be accessible virtually instead of the traditional analog face-to-face.
The primary role of our GP practices and dental practices is at the first point of contact between the patient and the national health of New Zealand. And with that, we want to maintain wellness. I really appreciate Vensa and their help to address our staff performance. We have national targets to meet monthly, and they give us campaign managers that will look after the recall lists with regards to our smoking brief advice, our CBD risk assessment, immunizations, and cervical smears. So that's a great thing, and that has really improved the National Health Targets monthly audit.
So we saw in a media release that the Ministry of Health has accredited Microsoft and Azure for storing patient information. And that grabbed our attention immediately to start the conversation with Microsoft, because in healthcare, data sovereignty and the way you store patient information is extremely important. So being on Azure, it's been great because we've been able to leverage all the security compliance encryption standards that is world-class, that's been implemented by Microsoft. So as an example, during the flu season, we would have an influx of patients booking appointments, an influx of reminders going through the platform. Azure is great because it allows us to scale to handle that traffic. We feel a deep sense of social responsibility to facilitate more people accessing timely primary care services. So that could be a worried mum, at midnight with a screaming child, that gives her the assurance that she's logged online and booked the appointment in 30 seconds. That just makes that night just a little bit better. And that's why we exist, and that's what it's all about.